Stroke means that the blood supply to a certain part of your brain has been cut short, right? So, and this can happen if you are hypertensive. What's up, beautiful people? Welcome to another exciting episode of Health Savvy with Dr. O. You already know. And as usual, I'm always excited to have you guys here with me. And no, I'm not gonna get tired of saying that. So anyway, today I'm discussing a topic that is very, very dear to my heart. Okay, a topic that a lot of young people don't take seriously, but it has actually taken the lives of a lot of people because they've taken it for granted, they've ignored it, or they just don't know about it, right? They are ignorant of the fact that it exists in young people, right? And in case you are wondering, well, you might have seen it in the title, I'm talking about hypertension, also known as high blood pressure, okay? Nicknamed or popularly known as the silent killer. Yes, it is that serious. It is the silent killer. And people really need to start taking it seriously, right? Because back in the day, people used to think that, okay, high blood pressure, hypertension is only common in older people, so it's for old people when you get old and blah, blah, blah. But now we're seeing it a lot in younger people. And I mean young people like 25 years old, 18 years old, 20 years old. They're now having high blood pressure. And not just a little bit of high blood pressure, really, really high blood pressure. Yeah. So I'm going to be telling you today about everything you need to know about hypertension, what it is, what the symptoms are if there are any, what you can do to prevent it, or if you have high blood pressure, what you can do to control your blood pressure, and different things like that, right? We're going to be talking, and please, I'm putting on a serious face, I hope, because I want you guys to take this topic very, very serious. It's a serious matter. In fact, it has now become state of emergency. And why I'm saying it's serious, because a lot of young people have actually died from this, like complications from hypertension, right? A lot of young people have died. You see, they'll say someone was hale and hearty one day, and then the next day he slumped and died, right? These are all part of the complications of hypertension, right? So we need to start taking it seriously, right? We really need to take this seriously, okay? I don't mean to scare you guys, but I need to tell you because it is very important. Please, check your blood pressure regularly. When last did you check your blood pressure? You ask a lot of people, they'll tell you, oh, last time I checked was last time I went to the hospital, which was like 2 or 3 years ago. Really? Right? Sometimes you find some patients walk into the hospital, and when you check their blood pressure, 200, 100, 180, 100, and you're like, how long have you been walking around with this kind of... I mean, that person is literally a walking corpse, sorry to say, but at any moment the person could just drop dead, could pop an artery in their head, lead to, cerebral hemorrhage. Cerebral hemorrhage means like bleeding in the brain. It could lead to anything. Like, there's so many complications. You could have a stroke, right? So you guys, you shouldn't take this thing for granted. You shouldn't take it for granted, right? Okay, let me stop being emotional. Okay, so let me calm down and explain everything to you. So when we say high blood pressure, right? So your blood pressure measurement is basically measuring the force of blood pushing against the walls of your blood vessels. So basically you have many blood vessels in your body. You have your arteries that supply blood around the body, and you have your veins that take the blood back to the heart, and lungs, so that it can be oxygenated. And very, very long story that you don't need to know right now. Okay, so let's focus on hypertension topic. So basically you have blood vessels, right? And when the pressure in that of blood, like when the pressure in those blood vessels is getting too high, it can be really, really dangerous, and it can lead to complications, right? Your blood pressure is supposed to be maintained at a certain level. So usually anything 110/70, so like 120/80 is okay. So let me explain that. 110, that is the upper value, is called the systolic blood pressure, and that's the measurement of blood pressure in your vessels when the heart is contracting. So when your heart is squeezing to pump blood out to the rest of the body. Whereas the 70 or the 80 I'm talking about, that's the lower value, is the one where the measure of blood pressure when your heart is relaxed. So after your heart pumps to push blood out to the rest of the body, it will now relax. So when it relaxes, the pressure in your vessels at that time is the lower one. And normal range should be between 110/70 to 120/80. For some people, it could go down all the way to 160. It's still normal. That's their normal. For some people, 90/60 is even their normal. That's okay. But anything getting below that, you might want to watch it, because low blood pressure is another problem on its own, which we're not going to talk about today. But today we're talking about high blood pressure. So basically, when you check your blood pressure and it's starting to go 140/90 and above, that's a red flag sign. You might want to do something about it, especially if it becomes consistent. We're seeing this a lot more young people. You guys think it's an old people disease. It is not. It's not an old people condition at all. More and more young people are having it every day, and it's becoming a state of emergency. That is why I'm really taking it very seriously. Okay, so like I was saying, I was trying to explain what high blood pressure is. So when your heart is working to pump blood around the body, as the blood is flowing through those vessels, if the pressure is too high, it can be dangerous for you, right? So let's talk about some of the reasons why people have high blood pressure. Some of the reasons can be smoking, alcohol, which not everybody, which might not apply to everybody, but applies to some people. So if you smoke, you're putting yourself at risk of hypertension. If you take alcohol, you're putting yourself at risk of hypertension. Another one is obesity. So your weight, if you're obese, right, you're putting yourself at risk of hypertension, especially if you eat a lot of foods that are high in fats and oily content. You're putting yourself at risk of hypertension, because we have something called atherosclerosis, where there is plaques forming in the blood vessels, and it's building up and building up and building up, and eventually it's going to block the blood vessels, right? So the more it builds up, the narrower the blood vessel gets. The narrower the blood vessel gets, the higher the pressure in those blood vessels is going to be. Just like toothpaste. You see how big that toothpaste tube is. At the top is wide, but when it gets to the bottom, that circle opening where toothpaste comes out from, it now becomes narrow. So in order for you to be able to get toothpaste to flow through that narrow opening, you have to squeeze, right? As opposed to if you cut the toothpaste open with scissors, the toothpaste will just come out freely. But when the hole is smaller, you have to squeeze. So that squeeze, there's higher pressure involved, as opposed to if there was a wider opening and it was flowing freely. So that was the best way I could describe it. I hope that example was good enough, but that's really about it. You want to make sure that the pressure in your vessels is not getting higher than normal. There's also the fact that if your parents are hypertensive, or if they ever had hypertension, then you are at risk of having hypertension. Then of course, hypertension, another risk factor, is when you are older, but at the same time, like I said, we're seeing it in younger people now. So this video is actually for the younger people. And then salt. When I talk about food, eating food that has too much salt, not just fat, but salt, is one of the major risk factors for hypertension, right? So you might want to cut down on the salt that you have in your food. All of you that like cooking, pack salt. Okay, let me confess, I'm also guilty of this. So in order to try and cut down the salt I use, if I'm putting salt in my stew, I don't put salt in my rice, I don't put salt in my plantain, I don't put salt in my yam and all those things, just to cut down the amount of salt I use. And bear it in mind that just because you are not using salt, you say, oh, I don't use salt, I just put a pinch, but I put plenty seasoning cubes. Hey, seasoning cubes, you know that thing that you call Maggi? It has plenty salt too. So you need to watch, cut down the amount of these things that you're using in your food. Use other things to season your food: onions, garlic, ginger, curry, thyme. The seasons are endless, right? You can use it to make your food nicer. It's not only just packing salt that will make your food to be nice. Of course, eating out will help to reduce this, because when you eat out, you don't know the amount of stuff they put in the food. You don't know the amount of salt that is put. You don't know the amount of seasoning cubes. You don't know the amount of oil and fatty stuff, right? But when you cook your food yourself, you're able to control some of these things. So yes, this is easier said than done for people, especially bachelors or people that have such a busy lifestyle, but it helps. Or you can get a dietitian or a cook to help you just do these things. Yeah, cookies, I mean, it's for the creme de la creme, but yeah, we'll get there one day. Now you think you have cook. Anyway, that's just by the way. And then another thing, which is what is affecting a lot of young people now, apart from the fact that their diet is a major factor, right? Because these days we eat a lot of nonsense, shawarma, suya, everything we're eating it. Then of course the smoking. Oh, I don't smoke cigarettes, but you're smoking shisha. Like I said before, it's the same difference, right? Another thing is constant lack of sleep. Hey, especially people that live in Lagos, you are guilty of this. Lagos, 4 a.m. in the morning, there's traffic on the road, and you're like, do people even sleep in this town at all? 4 a.m. there's traffic. Where is everybody going, right? At the same time, in the night, up to 10 p.m., there's still traffic on the road. Where is everybody going? Like, seriously, do people even sleep at all in your houses? So Lagos people, you notice that if you want to get somewhere on time, you must wake up early in the morning. I mean, if there's traffic at 4 a.m, you can imagine some people will say they woke up at 3 a.m. to be able to make it work up by 8 a.m. That's like a 5-hour commute, or you have to go to work earlier so that traffic doesn't catch you on the road, kind of thing. You are playing with your life. Oh, let me tell you some of the complications of hypertension or high blood pressure. One of them is stroke. Do you know what a stroke can do? Stroke means that the blood supply to a certain part of your brain has been cut short, right? So, and this can happen if you are hypertensive. Now, depending on what part of the brain, right, that blood supply was cut from, it could have different signs or symptoms. A lot of people, they have slurred speech, so they are not able to talk properly, so they are talking like with one side of their mouth or something. For some people, they cannot move one side of their body, right, the part of the brain that was affected. For some people, like, it could even lead to permanent disability, and in really, really complicated situations, it could even lead to death, right? Okay, stroke is just one of them. What about kidney damage? When you have consistently high blood pressure, it's damaging your kidneys. And you know, kidney, when your kidneys are damaged, you know you have to, if you damage it too, we'll be looking for kidney transplant. So you will have to depend on dialysis to be able to survive while they look for kidney donor or something for you. Trust me, you don't want to do that when you would have just saved yourself by just checking your blood pressure regularly to prevent, because like we always say, prevention is better than cure. So another complication of high blood pressure is heart disease. So it could cause heart disease, and this is what eventually could lead to like blockage of the vessels supplying the heart, and eventually lead to a heart attack for some people. So trust me, you don't want to expose yourself to all these complications when you could have prevented it in the first place by checking your blood pressure regularly. Now, why do I say check your blood pressure regularly? Because I was going to talk about the symptoms. Sometimes, in fact, most times, hypertension has no symptoms. See people, they're walking around with blood pressure of 200, 100, 180, 100, 180, 90, right? 180, 110. Those people, like I said before, they are like accidents waiting to happen, right? You don't want to be part of them. So check your blood pressure regularly, because your blood pressure might be that high and you wouldn't have any symptom. So you wouldn't know unless you check. If you're part of the lucky few that have symptoms when they have hypertension, headache is about the best symptom you get. You start to have headaches, these banging headaches are not going away. Then you check your blood pressure and they see that it is high. But besides that, people don't really experience much other symptoms of hypertension, except of course you've started having severe complications, and then you're having symptoms of the complications, in which case you have already reached the advanced stage. But before then, you really have no symptoms. So you'll be like, I'm all fine, I'm all healthy and everything. But you would not know that your blood pressure is high, right? So let's say you went to the hospital, you checked your blood pressure, and you found out that you were diagnosed with hypertension, right? So first of all, to diagnose you of hypertension, they would just check you once and say, just the first time you have hypertension. No, there are some times where your blood pressure can go up high, and then next time you check it is normal, right? So it's not just one blood pressure reading that they use to diagnose you and say you have hypertension. Of course, they'll be monitoring it regularly, but if it's persistently high, after 2 readings, 3 readings, you know, there has to be regular interval, right? So they won't check it now, and 2 minutes later they check it again. No, they leave a regular interval in between and check it. If it remains persistently high, then your doctor will tell you, depending on how high it is, they will tell you, okay, you know what, you need to control your blood pressure. And first, we usually like to start with diet and lifestyle modifications. So cut down on your salt intake. Salt also means Maggi. Maggi, I mean seasoning cubes. Cut down on your salt intake. Cut down on your fatty foods, all the fatty foods, oily foods, shaki, shawarma, this one, that one. You're cooking soup, there's oil floating on the top of it so everybody can see and everything. Cut down on all that, right? Then you need to do more exercises. Do some jogging, walk on the treadmill, go for brisk walking, you know, do some cardio activities like swimming. It can be something fun. Do aerobics, right? So that it doesn't feel like you're actively trying to, you know, work out and stuff like that. If diet and lifestyle modifications don't help to control your blood pressure, then your doctor may need to prescribe antihypertensive medications for you to help to control your blood pressure. Now, taking antihypertensive medications is not a bad thing, right? Because it's better that you take medications and your blood pressure is well controlled than for you to say, no, I don't want to be on medication for the rest of my life, and then you have a stroke. You won't only be on medication for the rest of your life, but you now need assistance if you have maybe one part of your body that is permanently disabled due to the stroke. You will now need assistance. So do you prefer that to actually having to take drugs to keep your blood pressure controlled? Lastly, before I forget, there are 2 types of hypertension. There's a primary hypertension and there's a secondary hypertension. So primary hypertension is something we call essential hypertension. That one comes with age, right? So there is no real cause. Like there was another thing I wanted to mention. Black people were at higher risk, or African people were at higher risk of hypertension, right? So you see that this essential hypertension is common in black people. Once they reach a certain age, maybe 50 and above, right, they start having high blood pressure, even if every other thing is fine, right? In those kind of cases, there was no real cause and there's nothing they can do about it. They just have to control the blood pressure. But in other cases, there might be causes attached. Some of them might be if you have hormonal issues, right, or kidney problems. That could also lead to hypertension, because your kidney is also responsible for regulating the blood pressure in your body. So enough of my ranting, okay? I just needed to get it out there. Like, everybody, please take your health more seriously. Check your blood pressure at least once a month. Start to eat healthy. Start to sleep more. We need you to be alive. You need to be alive to go check with Dr. O, okay? If you enjoyed this series so far, or if you enjoyed watching this episode, please don't forget to click the like button. And if you're not subscribed, don't you think this is a good enough reason for you to subscribe? Don't you think so? Please subscribe, okay? And don't forget to share this video with anyone you think might need to see this. Like I always say, a healthy you is a happy you. See you next week.